Hello, this is Devin Gianetti. Thank you for joining us again this week for another Board of Health briefing. We are going to begin with a brief message from County Executive Armin Budish, and then we will turn it over to Health Commissioner Terry Allen and Medical Director Dr. Heidi Gullett, and then we will take a few questions at the end. So now we're going to hear briefly from County Executive Budish.
Good afternoon. I'm not able to be with you all live this week, as my wife has finally convinced me that maybe I should take a day off. It is our anniversary, but of course I'm available for emergencies. I did want to take the time, though, to record this message about our foster care system. The county's been fully engaged in responses to COVID-19. We've purchased and distributed millions of pieces of PPE. We've distributed millions of dollars of grants to hundreds of small businesses. We've funded millions of dollars worth of rent relief so people don't end up on the street. And there's more. But today I want to address one of our most important efforts, and that's taking care of children who end up in county custody. It's our responsibility to keep our children safe, and we've been doing that even as the pandemic raged and we were all in shutdown mode. Our children and family services workers were out there checking in to protect families and children. We now have just under 3,000 kids in our care. That's a lot of children. And these kids need a home. It's always a challenge to find families who are willing to open their homes to these children. But COVID has made it even more difficult. Let's face it, we've all been pretty hunkered down over the last months. If we're reluctant to socialize with our neighbors or our relatives, it's understandable that families might be hesitant to accept a new person into their home. But we need your help. Now is the time for you to open your hearts and homes. We need families willing to foster and to adopt. If you're willing to consider serving as a foster parent, we'll support you. We'll provide great and supportive training for you through our Department of Children and Family Services. We can't leave these kids in a dangerous environment. We can't put them out on the street, and we don't want to put them into a cold institution. So I'm asking you, I'm begging you, if you have any room in your home, if you have any room in your heart, please bring in a child who needs a safe and healthy place to live. Call 216-881-5775 or visit everychildneedsfamily.com. What you do will change a child's life, and it'll change your life too. Thank you.
Great. Now we are going to hear from Health Commissioner Terry Allen. Thank you.
Thank you, Devin. And I want to thank, as always, Executive Budish. And I'm glad he's home with his wife on his anniversary, which is where he should be. We thank him for his leadership during this pandemic response and for his partnership. I also want to thank the County Executive's leadership team for Health and Human Services, who we meet with on a weekly basis to discuss a range of services related to COVID support for a bunch of folks that are really need help, who are vulnerable populations in this pandemic. We have great respect and appreciation for their commitment in these challenging times and everything that they do in their hearts with their talents to help folks who really need their help. So we really appreciate the partnership with them. Today, as Devin mentioned, I'm joined by our medical director, Dr. Heidi Gullett, and I'll turn things over to her when I finish my comments. So yesterday we heard Governor DeWine announce that Cuyahoga County will remain at risk level 2 public health emergency, or orange, in the public health advisory system. Counties at risk level 2 are advised by the Ohio Department of Health to exercise a high degree of caution. This continues to be good news, of course, and an indication that our county is still moving in the right direction. More people continue to wear masks, which we know are effective at reducing risk. Physical distancing, hand hygiene, surface cleaning, remote work, and staying home when you're sick are all part of the prevention equation. Our continued vigilance in following the prevention guidance is essential. We've seen counties move back and forth between red and orange in the weekly state public health advisory systems. So we have to continue to follow the playbook for prevention. It's also very important that we follow data trends over time to make informed decisions and to understand the trajectory or risk for decision making. As of yesterday, there were 15,316 cases of COVID-19 that had been reported in all of Cuyahoga County, including the city of Cleveland, with 15.5% of these cases, or 2,383 people, requiring hospitalization. And this is by far the highest number of hospitalizations in the state of any county. Of the total cases, 3.7%, or 570 people, have died in the last 6 months. Dr. Galt will discuss the data in our jurisdiction in greater detail. As we mentioned last week, we had an elevated rate of influenza in our community during the 2019-2020 influenza season, where we saw less than 50 fatalities in 6 months, and that was an elevated rate for us. So comparatively, here we are 6 months in to COVID-19, and we have 570 of our friends, relatives, neighbors, and fellow Cuyahoga County residents that have died from COVID-19, and we take a moment to recognize that loss. It's part of us, and it speaks to the severity of this pandemic. It's clear that coronavirus spreads easily, and people without symptoms can unknowingly transmit the virus to others. Infectious diseases do not recognize boundaries on a map. We understand from our case investigations that people move around widely across the region and beyond, with exposures often happening outside of the immediate community where a COVID-19 case may reside. This reality demonstrates the interconnectedness of Northeast Ohio with the rest of the state. On the flu front, we're encouraged by indications that influenza season in the Southern Hemisphere in places like Australia has been relatively mild. Influenza cases in the Southern Hemisphere typically start occurring in May or June, with the highest rate of infections usually occurring in July or August. Prevention measures like the use of masks, social distancing, remote work, staying home when ill, and hand hygiene procedures appear to have reduced influenza risk, along with getting the flu vaccine. This is encouraging information for all of us, as we typically see flu cases start to rise in the fall and usually peak between December and February. I will point out that we saw flu cases all the way through April this past flu season here ending in 2020. These prevention measures work and can have multiple benefits against a range of respiratory viruses. So we need to keep following our prevention playbook. And as I said last week, if there was ever a year to get your flu shot, this is the one. As I mentioned earlier, we continue to be encouraged by the movement from red to orange over the last 2 weeks. We know that our schools are closely watching the trends as well. The Cuyahoga County Board of Health, as always, respects that school districts and families are making very difficult decisions in very uncertain times. And we recognize that this pandemic has made life difficult for everyone. We know that education and extracurricular activities are a very important part of children's mental and physical health, and we appreciate the importance of resuming in-person activities when it is safe to do so. We'll continue to watch these trends as the fall curriculum, sports, and extracurricular activities begin in the community, and we'll monitor for COVID-19 cases and outbreaks that may be associated with schools. The governor stated yesterday that an order will be issued requiring parents to disclose their child's COVID illness to the schools. And he also indicated that these cases must be reported to the local health department within 48 hours. So we're now awaiting that order to understand the wording and the specifics as our schools. We are currently tracking 23 cases of COVID-19 in the school setting, with additional cases under investigation. These cases are among 19 students and 4 faculty, and they involve 8 school districts, and they're related to sports activities. We're aware that schools and communities are connected, and transmission of the virus moves between these 2 settings. We continue to conduct case investigation and contact tracing in the community, including the school setting, to reduce the risk for further community transmission. And I want to especially thank Ramona Brazil and Jana Rush are co-incident commanders for their leadership and coordination to best serve our community in this work. We continue to meet weekly with our school superintendents in collaboration with the Educational Services Center of Northeast Ohio. Schools remain critical partners in the fight against COVID-19, and we recently held a training for school officials on how we can work together to conduct contact tracing in the school environment. We know schools understand the movement of students and staff in the school setting best. Their active participation and partnership is essential and appreciated. Taking into account all these factors, the Cuyahoga County Board of Health maintains its current recommendations for schools and will continue to track trends going forward. We'll also continue to support schools by providing surveillance, outbreak investigation, and contact tracing for any outbreaks that are detected in the school environment. We'll also continue to track these trends in the coming weeks. As the governor stated yesterday, decisions on the delivery of curriculum, sports, and extracurricular activities are up to the schools. As school districts review their plans, we know and respect their responsibility to make decisions that best meet their needs and their respective school communities. And we remain committed to work with all our schools as they implement their final plans. Thanks as always to our incredible staff, partners, and all the people in Cuyahoga County that are living through the challenges of this moment and this pandemic. I continue to be inspired by the perseverance and commitment to community service that all of our staff at the Cuyahoga County Board of Health represent and have demonstrated through all of the challenges in these unprecedented times, and I will be forever grateful to them. Thanks for your time and attention, and I'd like to turn it over to Dr. Gullett.
Thank you very much, Terry. I'm going to spend a few minutes walking through our data and then talking to you a little bit about testing. So we had 529 new cases in our jurisdiction this week, and you can see that on our weekly trend graph. That also includes 30 new deaths this week as well from individuals in our community. As Terry said, we continue to really make sure that our team and the community never forgets that every time we present data, we're talking about our community. We're talking about invaluable members of our community. And in the case of the deaths that we report, these are forever people that we've lost in our community to COVID-19, and we don't want to forget that. If you look at our epi brief, we have a total of 10,689 cases as of yesterday. And you can see the breakdown, 91% of those are lab confirmed cases. Many of the probable cases came earlier when we had less testing, although we still at times have probable cases now. And a lot of times people want to understand how we determine that. And we have very strict, what we call case definitions, which are how we determine whether someone is considered a case or not. And this is becoming even more apparent as we work through cluster investigations and outbreaks in schools. We've been doing this all along since March, but many of the places we were working with earlier were congregate living situations and employers that were essential, that were still open. But now that we've moved into the school, we want folks to understand that we use the same definitions for what constitute a case as we have been. And these are the same definitions that are used at the state level as well as at the national level. And a probable case means that someone has been exposed to COVID-19. So you'll continue to hear us refer to the numbers, both lab confirmed, meaning they had a positive test for the infection actively, currently, right now, or they were exposed to somebody who does. And they themselves then became sick and met that definition. These reports here do not include rapid testing, and they also do not include antibody testing, which I've previously discussed at other briefings. But we thought it was really important to point out exactly what these cases are as more types of testing become available. And we will continue to brief you on the different types of testing as time goes on that are available to us here. Terry already talked about our hospitalizations, but we did want to present to you that just over 2.5% of those who have been the sickest needing hospital care have been in the intensive care unit, including some children, through the course of this whole pandemic here in our jurisdiction. And you can see that still about 38% of our cases are in the age groups between 20 and 39. So that is maintained pretty stable now for a month or two. And so we just want folks to understand where we're seeing a lot of the infections, that it is in younger individuals. These aren't necessarily cases that were at the very beginning. Actually, these are much more cases more recently throughout the summer. You also see that about 37% in the bottom right corner, about 37% of our cases do have those pre-existing conditions, meaning those high-risk health problems that make you at risk for having a tougher infection, maybe needing hospitalization, or maybe even have a serious outcome. But 34% of our cases don't have any of those. So no lung problems or diabetes or cancer. So again, these have been pretty stable in the proportions week to week, but we want folks to recognize that over a third of cases in our jurisdiction do not have any of those pre-existing conditions. So we all remain at risk, and we should all continue to do the things we know to do, such as wearing masks and distancing, and frequently cleaning and working and staying home whenever possible. If you go down to the next page on our EPI brief, you'll see our traditional EPI curve, which we've been presenting since March. And you'll see that this coincides with the decrease in the number of weekly cases that we have been seeing in the month of August. You'll see that peak that we had in the middle of July, which you also see on the weekly change number of cases. And we're very encouraged that cases are going down, but we want the public to understand that just as quick as they come down, they can go back up. And so we feel that this decrease in cases is partially a reflection of people really consistently wearing masks and doing those prevention activities we know work, but we need you to keep doing those because we don't want to spike back up the way we were in mid-July. And you'll see that our cases this week are still higher than any cases we had in June and previous to that. Below the EPI curve, you'll also see our zip code map. And this week, we have begun to include both our partners at the City of Cleveland and our Cuyahoga County Board of Health Department are included in this. We have the number of cases in each zip code included, as well as the shading. We do recognize that some of our ranges are wide, and so we wanted the public to have as much information as they could about exactly how many cases are within that range that's shaded. But we do want to we want everyone to remember that these are simply the zip code that was given at the time of diagnosis. This does not mean that this is where individuals were infected, nor does it mean that that's a higher area of transmission, because we know that individuals move about the county and they move about Northeast Ohio and beyond. So this is really important just to recognize the limitations of the map, but we hope providing additional information will be valuable. Finally, on our last page of the EPI brief, as I do every week, I provide information about the total or aggregate hospital utilization, meaning how full are our hospitals specifically here in Cuyahoga County. And remember that this does not include only Cuyahoga County residents, but rather it includes the percent of beds that are being used for total in our county. And that could be for people who have come here to seek care and maybe live in another jurisdiction. So you'll see that adult medical beds are pretty similar to last week, actually exactly the same at 84%. But our adult critical care beds are at 86%, and that is the highest that it's been since we started tracking this at the beginning of the pandemic. We do, however, also track the percent of COVID patients related to that, and we're still remaining fairly stable. Less than 10% of those in the ICU in Cuyahoga County are there because of COVID-19. Pediatric beds have remained consistent over the last few months. You'll see at 54% utilization this week, and you'll see our ventilator usage is slightly up at 42%, and that has remained pretty stable over the last few weeks. Finally, as we do each week, we present the total tests that were run between the 3 hospital labs, Cleveland Clinic, Metro Health, and University Hospitals. Those 3 labs this past week ran just over 18,500 cases or tests, and there was a 4.3% positivity rate. So we are pleased that the positivity rate has remained low again. But again, we watch this closely because a trend is what we need to see, not simply 1 or 2 measures. The last thing I want to say about testing is that in addition to what I presented at the beginning to help us figure out what kind of a case is there, we also need to recognize that sometimes there's confusing information about testing. And we want everyone to be clear that testing is a critical element of our COVID-19 response in Cuyahoga County and in other parts of our state. And we are committed to continuing to test where we feel it is necessary when there's an outbreak, whether there are symptoms or not, but also in the community. We need testing to continue in the community. And I would really like to thank our hospital partners for working really hard to think about how they can contribute to the community testing. The same is true with our community health center partners. So the message from us is that testing remains a vital tool in our toolbox in order to get ahead of this, and we will continue to use it as much as we have available to us. And as new testing comes available, we will update you on its availability here and exactly what kind of tests they are, so that you hear from us exactly what kind of tests are available in our community and whether or not you might need to seek one. In my moment of gratitude today, I would like to thank an individual who works here behind the scenes, who you don't see, but who worked incredibly hard when we had our water main break last week. Her name is Becky Burke. She works incredibly hard all the time and does a ton of things behind the scenes. But she worked really hard, and you knew that we weren't here at the office last week because this had happened, and there were some additional things that needed to be done, and she just did them and presented a really succinct but comprehensive picture of all that she had handled to our board this past week. And I just am personally incredibly grateful for her continued sacrifice, working so hard to allow all of us to do our jobs better here at the Board of Health. And lastly, I'd like to thank the group here in the Board of Health that has been working really hard on the school recommendations. We have a diverse group, from our environmental public health team to our prevention and wellness team to our communications team to our preventive medicine physician team, and everyone has come together tirelessly to really answer questions in real time, ensure that our meetings with superintendents and school leadership are informed by data, and to make sure that we are presenting everyone with the best options available for how to manage instruction and extracurriculars during this really challenging time. So I wish I could name every single person on the committee, and I won't for time, but please know that I personally, and I know our team here, really thank every single one of you, because this is a critically important thing for our children, and you guys are really putting your heart and soul into this, and we thank you for that. With that, I'm going to turn it back over to Devin for questions.
Thank you so much, Dr. Gollett and Terry. Really appreciate it. We now have some time for some questions. Just a reminder, if you are not asking a question or speaking, please mute yourself. And with that, if anyone has a question, we can do that now.
Hi, it's Courtney. I had a question.
Okay, go ahead.
Last week you had discussed that there had been some difficulty getting some folks to cooperate with contact tracing because kids wanted to keep participating in sports and were concerned that maybe they wouldn't be able to participate. I'm wondering if you're still having that issue with kids or schools or extracurricular activities, and if so, are you concerned that that means you're not identifying all the possible cases out there?
Thank you. I'll take the question. Thank you, Courtney. So I think, kids, I have young kids, and so I understand. I think that that can be from time to time a challenge that we face. We generally find that people are pretty forthright. From the beginning of the pandemic, we rely on people to talk about close contacts, to tell us where they traveled so that we can understand risk. So we feel that generally people are very forthright. And so I think when the risk is explained and they connect with the people that they trust in the community, and we hear from their families and critical people within the school environment that they trust, we end up getting the information we need in most cases. So it's something we want to make sure that people continue to be aware of, that if we have the best information available about where people have been and who they may have been in contact with, we're in the best position to try to get things moving again. If there is a stoppage of sports, for instance, or some pause in some extracurricular activity, we want things to be able to move forward if schools have chosen to move in that route. So for us, that information is critical. I'm glad you brought it up, and we continue to ask that as we call, the people pick up the phone, as we have since the beginning of the response, and also that they provide us the information we need to protect others. It isn't just about the individual students. It's about people they may come in contact with, and perhaps even vulnerable people who may be at risk for severe complications. And so this one is bigger than all of us individually. And getting the best information possible, we continue to seek, and we generally do get it. From time to time, there will always be bumps in the road, but the schools have been fantastic partners from the beginning, because we know that we're in this thing together as we work through the here into the fall, and we'll continue to do that and working closely with them.
Great, thanks, Terry. Thank you, Courtney. Any other questions? Okay, well, thank you all very much for tuning in to this week's briefing. And if you have any other questions, please don't hesitate to reach out. And thank you very much, and have a great weekend.